This podcast is for educational purposes only. The information presented is general in nature and is not medical advice, diagnosis, or treatment. Watching this video does not create a doctor-patient relationship with the hosts. Always consult a qualified healthcare professional regarding your individual condition before beginning any treatment or exercise program. If you are experiencing a medical emergency, seek immediate medical care. Hey everyone, and welcome back to the Two Bros and Some Joints podcast, where we talk about the different kinds of aches and pains patients have and what options for them may exist. We also help break down common myths and just chat about our own personal experiences in private practice. With us as always is Dr. Nick Hunt, a rehab chiropractor from Jacksonville, Florida, in private practice now for over 4 years at RTA Rehab Chiropractic. And I'm Dr. Austin Ehmke, rehab chiropractor from Omaha, Nebraska, in private practice as well for over 4 years now over at Body Kinetics Rehab Sport and Spine. Dr. Nick and I graduated together from Palmer Chiropractic in Daytona Beach, Florida, with a mission of elevating the chiropractic field through an evidence-based, patient-first approach to musculoskeletal injuries. Throughout these episodes, our job's simple: help you guys better understand your body and your options regarding your aches and pains. Today, it's a fun one for us, right, Nick, where we're talking deadlifts, and call them deadly deadlifts because are they bad for your back? Should you be doing them if you've got back pain? My doctor said I got a disc herniation. He said I should stop doing deadlifts because it's bad for my back. Let's dive into it. Nick, let's just start with the first thing are deadlifts bad for you? Inherently, like at the base, are they bad for you?
Yeah, inherently, the answer is no, an emphatic no, actually. A lot of the research will show that, in the case of low back pain, especially because it is such a posterior chain heavy and exercise, it will build strength in the glutes, low back, hamstrings, all the stuff that is necessary to improve function in people with low back pain. So you and I have the anecdotal evidence of, like, we use these things to help people who have low back pain and disc injuries and all these things to build up the tolerance, build up the strength around it, and stability and control. That being said, there are risks that come with it. And even on just a cursory Google search, the Google AI will sit there and tell you, it's like, lower back strains can occur when you lift with a rounded low back or ego lifting and pull a weight that you cannot fully handle yet.
Yeah.
The way that we word this is load management.
Yeah.
Yes, there can be form techniques, issues like that. Range of motion from the hip, compensating rounding into our low back, trying to pull with our back rather than push the floor away. There are issues with technique and form, yes. But however, people can break this stuff down into saying, okay, should you be doing this? Let's turn a deadlift into a breathing exercise, learning how to brace, and you take away the desirable effect of actually building a strong back and posterior chain.
Yeah, I think it's important to make that connection, is that it's not that the deadlift itself is bad. It's that if we approach anything in life too quickly, doing too much too fast, or too little for too long, and then doing too much too fast, is where the injury starts to happen. Now, there's also a risk to reward benefit for those of us who, let's say like you and I, and we work with plenty of really active either athletes or adults who are incredibly active in the gym. There does come a time and place where the risk to reward ratio for, let's say, like even no longer like, say, a novice lifter, but an amateur or a master's lifter, where, hey, you're deadlifting north of 500, 600, 700 pounds. There is a risk to reward ratio we do have to assess. There is a time and place where is the risk greater in these people? Yes. However, need I remind everybody listening, or even ourselves, that's such a small percentage of people. The amount of people who can get into the weight and into the range and into the reps that you can do some actual serious damage when things go wrong, if they ever go wrong, is so small that it's almost negligible. So it goes without cause to say the people who are typically getting hurt in these scenarios, and it's commonly the people that you and I don't treat, aren't the people who are deadlifting 600, 700, 800 pounds plus. Those are people we're not treating. Why? Because guess what? Their form, their technique, their load management are so honed in. They know what they're doing. They're not getting hurt. And it's because they understand, hey, you know what? Today I've got like this sinus thing going on and I'm not feeling the best. I probably shouldn't push the load a whole lot today. Or, hey,
They
I
know
was
when
dealing.
to pull it back.
Yes. Or, hey, it's been 10 years since I've been in the gym. I wanted to get back in the gym. I probably shouldn't start ripping the weights that I was ripping in college. probably like
Right.
both cases not the safest thing to do, and it doesn't always
They
make
sit
sense
there
until we
and think
say
that,
it.
yeah, they sit there and think, oh, yeah, I used to do, 300 pounds, I haven't been to the gym in 10 years, but, I should be able to just pick that right back up. And then they go into it, and next thing you know, they're out of the gym for 2 more months or more.
Yeah.
Or some people just give up entirely after they had that one injury, and they say, well, no, that really did me in.
Yeah.
And then even with that, I'll just like throw my hand out there. Like, I personally am one of those people who has, I think my deadlift's just shy of six. I've
Mhm.
never quite pulled the 600 number, but I'll tell you this: whenever I'm doing those heavy stuff, I'm it is dialed in. e- Everything is focused about how am I maintaining this, and if I get to the point where I'm like I'm rounding this, or if I decide that I'm going to pull this weight and I shouldn't,
Mhm.
I'll drop it, because that risk, I know that that's coming. If that form starts to give, just because I want that extra 10 pounds on that lift, is not worth the next few weeks of trying to put yourself back together after a strain like that.
Right.
And people got to be aware of that too. Like, when to force a lift on a PR, like if you're in competition, you're actively competing and trying to get these PRs in place and do all this stuff, like that can be where you push through it, as so long as you keep your form. And you might struggle and grind it out, but you can get it maintaining form. I've had several lifts where I get the bar up to my knees and I can't quite lock out without sacrificing that form. I had to drop it, because I'm
Yeah.
like, this is not worth it to me to wind up having to seek out care and work on these things and put myself back together after
Mhm.
that fact. So, along these lines that we're talking about, w- is it appropriate for you to do? Is it dangerous to do? Let's talk about who should be doing this, and
Yeah.
whether that risk to reward is actually worth it.
Yeah.
Because when we talked with, you and I work with a lot of different athletes. um, if that lift is part of your sport, say you're a CrossFitter, you're going to do deadlifts, or you're, competing in strongman, Olympic lifting, whatever it is, powerlifting meets, you're going to do deadlifts. So you should
Yeah.
probably train it and
Mhm.
build up those muscles. For people who want to do daily stuff around the house, you should still absolutely train that stuff. You want to, be able to go out and garden and spend all day bent over and stand back up at the end of the day. We should probably have some strength in our low back, in our glutes, and our hips,
Just
and
a
all these
little.
things. But that doesn't mean you have to be pushing serious weight.
Right.
Doing the movement with an appropriate load, building strength, does not mean you got to be maxing out, going crazy, chalked up, and smelling salts
Yeah,
out
you don't
here
need to
in
be
order to do
fully
this.
equipped. It's and I think that's an important
Exactly.
distinction to catch you at is when we talk about deadlift, there's two different ballparks of people. It's you see when people imagine, my doctor has me this rehab guy has me doing deadlifts. People imagine you deadlifting 400, 500, 600 pounds. I said it at the very beginning. There's such a small percentage of people who ever will get there and do it safely and regularly without hurting themselves. And for the majority of the patient population who just want to go garden, like Nick said, it's not that important to actually get you there. And so if you have a clinician who's good at what they're doing, they'll say, look, Mr. Smith or Mrs. Jones, it's probably not that important that you deadlift 225 pounds. If you want to do that, I can probably teach you how, given enough time. However, Mrs. Jones, you just want to garden. So you know what we're going to do? We're going to maybe go grab this trap bar, this hex bar deadlift. We just want to get you into a safe position so we can get you to learn how to do a proper hinge, learn how to load your posterior kinetic chain correctly. Though that's where there's an important distinction between it is still a deadlift. However, we're teaching Mrs. Jones how to pick up her potted plants that weigh 50 pounds because she digs digging. She wants to go outside. She wants to go do gardening. And I'm not going to let her stop doing that. But to get there, we might use the deadlift as a tool rather than I want to get her in a
Exactly.
powerlifting competition. Like, no, that's not the goal.
Exactly. Yeah, we're not putting little Susie in a
No.
onesie out there and and
Nah,
chalking her up and saying, "Let's go."
she's not
It's
getting
like,
fully equipped and ripping it. That's not what we're
don't.
doing.
Yeah, no,
Let's make sure
no.
that's clear. Yeah.
Yeah,
Sick,
life's
but
a garden.
if you
Dig
want to
it.
do it,
So
we'll
we got to
teach
get her in
you.
there.
If that's your goal, we'll teach you how to do it. But that's
Exactly. Not
not
use
the
that.
99% of their goals. That's not their goals.
No, exactly. And I use that framework with a lot of my clients. It's just like, hey, look, if you know you tell me you want to go deadlift 500 pounds, it's like, okay, cool, we're going to put this on our list of goals of what we're going after here. But from what I can tell, you're wanting to do this general fitness class, this boot camp style class, and your back's killing you every time you do any of these movements. You don't need to lift that much in order to be strong and safe and everything, and not hurt. Understanding how to do the movement so we can use that tool, like you said, to build up the structures around it, build up some stability and some strength and some resolve around our low back. That will allow us to do the other things. And so it's also important to know when to use it for these people,
Hmm.
and saying, okay, this is, this is where we're at. You don't need to be going crazy, crazy heavy with these things in
Right.
order to get this feel. How many times have you dropped weight on an exercise, added reps, and still, felt it the next day? This is going to happen. You work it in a different way. Same muscles, same movement, even in a different way, you're going to still get results out of that are going to help. And a lot of these people, they don't need the one time strength, the one rep max. They need some endurance in their low back that it can
Yeah.
handle repetitive movements. So if we work a low weight and get up to 10 to 12 to 15 reps, it's like you're going to be under that bar for a long time working muscular endurance here. Still working the same muscles, same structure, same movement, building endurance rather than a one rep thing where you can move it for
Yeah.
6 seconds and be done, or you can, continuously get up and down off the ground while you're out there gardening. And using those different principles, I think that that's super beneficial when you talk with these people about how we're actually using a deadlift and
Yep.
why.
Yeah, it's the importance of general preparedness. Nobody can, and people still do. I don't know how or why they still think this way, but we have all of the evidence under the sun at this point to contradict this belief or this myth that preparing our bodies for movements by just using core principles of good old strength training and resistance training is going to somehow damage your body. It's going to hurt it. It's not true. We know this. And in fact, even when it comes to just not even general preparedness, but you can get as specific as like the thing that we always hear the association between is like disc herniations or low back pain with deadlifts is like, oh, if you do these things, it actually is going to make it worse. Well, fun fact, we have all of the evidence to support it, and it'll be in the show notes. All of the evidence actually points to the contrary, is that even utilizing these things in some cases made it better. And even in the worst cases, it actually came out at the exact same as just general prescribed exercises. Now, the thing that we always question afterwards is okay, where are these people going after they're done with their clinicians? Are they trying to go back to the gym? Because then when we follow up with them in 24 months or 36 months after, you know what we find? That they actually did better because they had better preparedness. They built more capacity to the movements that they wanted to. Really, what it boils down to is what are their goals? And Nick, that's essentially what you're saying, right? Is like, what is their goal? If their goal
No,
is to do
absolutely.
something that is going to require them to get into a hinged position, there's probably nothing better than a deadlift. And if you're concerned about a disc herniation, if you're concerned about back pain with it, there's evidence, mountains of it at this point, to support actually, if you start practicing this thing, you'll build capacity, you'll build resistance to that movement. That when you go to lift, say that potted plant, when you go to lift that bag of mulch, guess what? You're accustomed to lifting, let's say 100 pounds or 150 pounds. So that 20-pound bag of mulch is nothing to you anymore. That's what we're
Hmm.
talking about, is building the capacity and the resistance to protect your back. Think of it as a set of training wheels rather than something that's damaging it.
Right. No, and that's exactly such a great point. If I were to say we're going to go test our 1 mile times, uh, Austin, me and you might be struggling. Cardio sides of it, we might have a little rundown there.
What
But
am I
if I
running
was really
from?
trying to get this mile time down and the ability to run it without running out of steam, is my practice is going to be to run a mile and a half so that when I do that mile, it's easier.
Yeah,
So when we try and pick up a 20-pound potted plant, because we've been deadlifting 85, 100, 125 pounds, depending on who you are, that 20 to 40, 50 pounds is going to seem light compared to what you've been doing.
right. And
And
that,
that's that concept of preparedness. You're
yeah,
over preparing so that when the daily activities that you like to do come around, you're ready to, you're ready to answer it.
yeah. And that really it shuts the book on, is it safe to do these things? Yes, it is. And in fact, it's actually now recommended that you practice these things. Why? Because your day to day life actually needs it. The other questions we always get, and I'm sure you've probably gotten these plenty of times over the years of practice so far, is I don't know. It said that my doctor said that doing deadlifts will cause my back to get worse. It'll make the arthritis worse. It'll give me disc herniations. How do you talk to patients about that? How do you obviously when we're never going to give a patient a hard time for being ill-informed or misinformed because it's not their job to. They might be Joe from accounting per se. It's like it's not his job to know this. It's our job to know that. How do you approach that with a patient when they tell you that?
The first thing that I often say is like, when you look at the research, the numbers, and we've talked about this in other episodes, the numbers explicitly show that people walk around every single day with no pain, have arthritis and all these issues, and they
Oh
don't
yeah.
have any issues whatsoever. They can be super active, they can be sedentary, but they've got these issues like arthritis and disc bulges, and they have no pain. So why is this one different?
Hmm.
And so that's often what I pull up as saying, you're not your diagnosis, you are a whole person, and the reason that you have this pain could be partially attributed to these findings that these other doctors have found in their imaging, the arthritis and all this stuff. But by no means is that a curse on you to say that you can no longer do these movements. You should never do these movements because they're going to make things worse because you have this. And I'll tell you, the amount of people who respond well to that conversation of just like, okay, I don't have to be stuck in a box
Yeah.
because I have this diagnosis. I can still go live a full life and do the activities I want to
Yeah.
do because of this. And they get put in there. They get that fear tactic a little put into it. And then they show that fear avoidance.
Hmm.
Whenever you show that fear avoidance, you don't want to do that exercise because you're afraid of it. The more likely you're going to feel something coming into it because you don't have the confidence to sit there and say, this is more likely going to help me because you're already convinced that this is going to hurt you.
Yeah.
And
I've
so
actually
breaking down that mental wall.
I've actually seen patients start to become a little bit more skeptical of this. And not that they're skeptical of their doctors, but they're just more willing to question things, which is fantastic.
Mm,
I've always said you should question everything. It's totally fine to. Now, question it with an inquisitive and a curious mind, not one of just being an asshole. Like there's a
yes,
difference.
there's
Be
a difference.
inquisitive. Ask your doctors, like, hey, why, you said this, why? And if they can't give you an answer, that's okay. The amount of surgeons I've seen actually rehab people is zero. Just like the amount of people I've performed surgery on is zero. We we stay in our lanes and we do but the problem is that I'll hear that overarching theme. I had a patient just this last week who came in with what we call the shits now. You can thank Adam Meekins for that. Something hurts in the shoulder syndrome, the shits, because we've gone away with the days of shoulder impingement and calling it that diagnosis. Dr. Neer, the one who invented it, long live that person. But however, they weren't correct in what they thought was going on in terms of the impingement syndrome or the theory behind it. But we call it the shits now, and they're like, yeah, they said I had like a hook or something in my shoulder, and that was causing it. And I'm like, they're like, well, if I had that there the whole time, why did it just hurt now? And I was like, hey, like, yes, you're getting it. And so patients are starting to pick up on this. They're like, wait a minute, that doesn't make sense what you just said. And it's okay to question those things. Again, be curious, be inquisitive. Don't be an asshole, but be curious and be inquisitive, because now that we hear this, I get that too with their disc. They're like, yeah, I feel like it's been there for a while. I had this pain like 20 years ago. Do you think it's the same? I'm like, it probably is. But it might be related or it might not be.
No, absolutely. And the way that medicine improves is by people questioning it. That's how research is done, is you have to question the consensus already to say, let's go do this thing. If this proves it again, then we'll keep running with this. If the
Yep.
shoulder impingement had been, proven right in those research, they'd still use that terminology. But somebody questioned it, they followed through with it and said, "Hey, actually, this isn't really what's happening, and we can show it and we can prove it." And
Mhm.
that's how all medical science really improves, is by people questioning it, not because everybody's being an asshole, but because people are questioning it and willing to seek out the answers. And they also know that, hey, part of this might prove this thing right.
Yeah.
And if that's the case, so be it. Then we know we were on the right track, and let's keep
Right.
following deeper here and figuring out how can we continue to help this.
It's like like Udi says, Dr. Udi Kerbal, he's a knee replacement. I would call him a specialist, the conquistador of what he does up at NYU. He's insanely good at what he does. He says, "Is wait 5 years, something's probably going to change. We'll probably get better
Mhm.
at something. We'll probably learn that we were wrong. Wait 5 years, we'll probably learn something new, and that's good. That's great. It means we're just getting better at what we are right now. If we think we're good right now, like we're just going to keep getting better." Um, and to go back to that, it's, like, can a patient who has disc herniations, multi-level or severe disc herniations, can they actually perform a deadlift? All the evidence so far actually says yes. We've actually compared it against like general exercise or just corrective exercises, even in cases where we did specifically what's called like posterior kinetic chain resistance training, or PCRT. We've done that in comparison to just regular corrective exercises for patients with lumbar disc herniations, and it turns out they actually both got better, which was cool to see, because it kind of, although at the end there wasn't statistical difference between both of the groups, the fact that one group got better with corrective exercises and the other group got better using the thing that we were touting or we were saying would hurt people got better at the same rate. So what did that mean? Wait a sec, this thing is actually not as dangerous, or isn't dangerous at all, in compared to what we used to think. Wait 5 years, our opinion will probably change.
Yeah, no, I absolutely agree. And so here's a little concept I'll throw at your way and see what you had to think about it. A tool is only as useful as the person using it.
Yeah.
So if you don't know how to use a hammer and you're trying to hit the nail with the claw end of it, I mean, it's probably not going to work. That doesn't mean the hammer's bad,
Yeah.
but it means you don't know how to use it just yet. You don't know
Right.
how to apply it in the correct way to get the outcome that you desired. And so when we're talking deadlifts, uh, so if I'm working with an athlete who is an explosive athlete, um, they might not need a slow moving strength exercise, but they need to be able to develop more power. And so we would look towards like maybe like a clean or something like that that would show a little bit more explosiveness in part of the rehab. But you know what the first fundamental basis of the movement of a clean is when you come from the ground is a deadlift.
Yeah.
So the fundamental pieces of that movement translate over into so many different things. And it's like, okay, well, how are we actually applying this thing? Because they don't want to work on, you know, heavy, slow movements that only build strength. They want to do power.
Yeah.
So they're going to do these things fast. It's like, well, the faster you go, oftentimes the more form will slip. So
Yep.
let's break it down to the fundamentals and say, okay, let's revisit how we're doing this movement, this pull,
Mhm.
in order to get where we're trying to go.
Right.
The only way you can get where you're trying to go is by knowing where you're going.
Yeah.
And so if you know where you're going, you can start that, start your drive. You need to know you need to make a left turn out of the driveway, or you're just not going to make it out of the driveway.
Right.
And
Well,
so
and
if we got to know where we're going with this, you got to know how to apply it. And this is where the stuff, seeing like someone like you or me, or even an experienced personal trainer or lifting coach will be able to say, hey, actually, this is how we're gonna break this down to the small nuances to kind of figure out this hinge movement here. um, and say, all right, this is how we're going to use this. This is the form that you're going to take, knowing how you move and the goal that you're trying to get out of it. They can look very different.
yeah, I think in short, what you're trying to say is like, if you have a clinician who knows how to utilize this tool of a deadlift appropriately, not only so this is dismissing every argument that every other clinician or provider or whoever can make against, oh well, deadlifts are bad. It's like, no, we can't even have that conversation because we proved you wrong. We have all the evidence to do it. It's, can the clinician help you navigate that movement safely, is what Nick's trying to say. Is like,
Absolutely.
if the clinician, and if the clinician, number one, can help you navigate it safely, but number two, if it makes sense for you to do it, then yes, it's safe to do it. And in fact, even if you have severe arthritis in your back, even if you have disc herniations in your back, you can actually perform the movement. And in fact, we've proved that it's helpful, which is hilarious because it goes against everything that used to be touted left and right, said in surgical rooms, said in PT clinics, said in chiro clinics. I've heard it in all of them. It's like, oh, I don't know, rounding your back like that's bad. It's like, oh, it turns out y'all were wrong. And in fact, you were so wrong
Hmm.
that it's not even dangerous when done correctly. And that's what Nick's trying to say is if you have a good place, if you have a good clinician and your goals align, it is a fantastic tool to use. Just like we were talking about earlier, you don't need to be fully equipped. You don't need to be trying to rip 5, 6, 700 pounds off the ground. You just have to perform the movement. You have to be able to know how to scale it. You have to understand the functions of it. And then if your goals get loftier as you get better at something, be my guest. Start to rip into some stuff. It kind of goes into the old homage, like, I don't know, lifting. If you lift weights with your back, right? It's don't lift with your back, lift with your legs. Like, well, actually, it turns out lifting with your legs and your back is beneficial. Lifting with your back alone is beneficial. Lifting with your legs alone is beneficial. It's all beneficial. Weird how that works, right? Wait 5 years and shit'll change. Just wait 5 more years. More shit will change.
Yeah, and we'll have the same conversation in 5 more years
Oh
and
my
say,
God.
okay, here's what we were talking about then. This is what we're talking about now, and see the
Yeah.
difference. And we'll have so much more evidence even by that point, I'm sure,
Oh
to
God,
say
yeah.
like, okay, here are the actual specifics. We broke this thing down to, study people who did it with bent back versus overarched back versus neutral spine, and made sure that their form did this, and we
Yep.
reported the results. I'm sure that that kind of stuff will eventually be out there. Um,
Yeah. I think you could get
and
it
there's the
even
other
more
thing too.
specific to like, because this is something else too. Is like you could get even more specific later on. This is for all the researchers that are out there. Is like people who have different tibial to torso ratios or femur lengths differences, because obviously we know this. We see this in clinic. Is wow, that person deadlifts different than that person. Like that person's way hinged over, or that person has to have a rounded back when they start the pull, or that person starts a little bit higher. It's like, well, yeah, that's their body. Like I don't. I
Yeah,
always use Jess Butner or like John Hack. John Hack's my favorite person to use as an
yeah.
example. World record holding, world renowned powerlifter. John Hack's arms go down to like the middle of his shins, so that he doesn't have a lot of
His
distance
start
to.
position is higher because his arms
Yeah,
can reach lower.
he's got
No,
some
and
like
that's
crazy
absolutely the
Mr.
case.
Gadget arms. It's wild how long his
Yeah,
arms are. So
those
like
spider arms here.
seriously, but like that even too is like we see differences in that, and we see differences in how people feel it. It's like, so to just generally say, I don't know, if you have disc herniation, you're not supposed to deadlift. If you have this, you're not supposed to deadlift. It's like, no, no, no. It's like, stop making just grotesque overarching statements that claw out, number one, the confidence of people. You said this earlier. You're clawing at the confidence of that athlete. You're clawing at the confidence of that patient that performing those tasks is unsafe or isn't normal, or that their back is fragile and damaged. It's not. Your back is one of the strongest damn muscles and muscle groups in your entire body. It's insane how strong your back is. I don't know if you remember when we were doing cadaver labs, the amount of layers of muscles not only we had to learn, but the amount of layers of muscles we had to pull apart to like get to somebody's spine was insanity. It was like 13 racks of ribs in a row to try and get to the
Oh
damn
yeah.
spine. It's like,
Oh yeah.
oh, like I see now why your epidural needles feel like they're like this long. It's like you got a
Like
long way to go. Like, damn.
exactly.
Like, jeez.
I also think if more people could see that kind of stuff, they'd also be like, "Oh, well, look how all these things are put together. It's just like
Oh yeah.
this thing should be damn near indestructible, rather than like, oh, I'm so fragile, I can't, pick up more than 5 pounds because my doctor said so."
Yeah.
And it's like, I struggle how people think they're going to live life with not picking up 5 pounds due to doctor's orders. It's
Yeah.
like,
And you and I will always appreciate the nuance. It's, if you just had some sort of like catastrophic surgery or something and there are weight limits put in place, yes, there's a very good reason for those weight limits to be put in, or those weight restrictions to be put in place. But that's different than what Nick's talking about. And what he's talking about is somebody who's been told, oh, that lifting overhead or lifting weight in front of you or lifting from a bent position is unsafe, with no pretext, no context whatsoever. Just, oh, I don't know, Mrs. Jones hurt her low back and her spine doctor said you should probably just stop lifting in that position. It's like, well, that's not helpful. How's she supposed to do her laundry? How's she supposed to clean
right.
her dishes? Like, did we just completely admit guilt to like all of those things are technically, quote, dangerous? Or did you just lie to a patient because you were lazy, you didn't feel like educating yourself on it, or you just haven't expanded your knowledge on, oh, wait, these things actually aren't dangerous? And that's what we see a lot of now. And it's starting to turn a page, basically. Patients are starting to question it, which is great. You don't have to be an ass when you question your doctors, but just be curious, be inquisitive about it. It's okay. Because I guess would you say like those are the most common? I know we kind of talked earlier. Is like those are the most common three things. Is like, is the exercise safe? Yes, the exercise is perfectly safe for you with a deadlift. Well, what if I have low back pain or a disc herniation? Yes, again, the exercise is still safe for you when performed, like what you said, correctly, and if it's the right tool, right? The third
Done
part,
correctly, the right reasons, the right exercise for the right reasons to fix the right problem at the
yeah,
right time. We got to have all these little things that are just like chipping away at like checkbox, 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 and say like, okay, when someone first hurts their back, they probably and they're struggling putting on their shoes. It's like a deadlift is probably not the thing that you're going to be
yeah,
needing to do right now because you can't even reach down and touch your shoe and
right,
tie your shoes. It's like, okay, that's probably the wrong time.
right,
However, after we get that capacity and ability to bend down there again, we
mhm,
can keep a neutral spine. It's like, okay, now we can get down to the bar. Now we're literally just going to lift the minimum to go through the movement. We might
yeah,
not even do weight
yeah,
and just to work on the movement, get the stuff back. Essentially, you're practicing neural firings. For neuromuscular firing, you're going to get the patterns down, the movement patterns down, and say, now when I do load this, I'm going to have a better chance at this being successful
mhm,
and maintaining my form to get the right muscle activation to get the right end result because of this. But it's also not where everybody starts. And so taking
yeah,
that kind of stuff into it as well, it all depends on where you're at when they get given to you,
yeah,
like
yeah. It's I even some patients too. I won't ever like fully graduate them into like a deadlift if they already know how to deadlift. But mainly right now, my goal is to just get them out of pain quickly. I'll start with simple things like a graduated rack pull or a simplified version or a modified version of like Jefferson curls. Obviously a lot of extension exercises with like the Roman chair or HyperX and stuff. Like there's reverse hypers. We don't have one in our office. Wish I would buy one. That's probably my cue to go buy one. Like all of these things are incredibly useful for strengthening the back, but it's just where's the patient at, and that's what makes that question so nuanced, right? Like, is deadlifting bad for you? It's no, it's not inherently. However, can you be a silly goose about it? Can you be stupid about it? Yes, of course you can, but you can also be stupid with every exercise. Just like anything, you can be stupid about grotesquely applying what is it, like antibiotics, like generalized antibiotics. We were stupid about that. What did it end up doing? It ended up creating antibiotic resistant strains of forms of superbacteria. Like that's one of my buddies is a pharmacist. It's like his greatest nightmare is to accidentally create a superbacteria one day due to overgeneralization of prescribed generalized antibiotics. Like that. So it's even useful in forms of in reaches of healthcare that we have nothing basically to do with. Overgeneralization is a bad thing. Specificity, good. And that's why, hey, for each person, can the deadlift be safe for you? 100%. But are you doing it at the right time? Is it the right tool? Is it the claw end or the flat end of the hammer? Ask yourself that.
exactly,
If it's the right
exactly.
tool, then perfect, yes. But make sure, do yourself a favor. Make sure you're doing it correctly. Make sure maybe you need some oversight. Do you need a personal trainer? Do you need a rehab chiro? Do you need somebody else to help you with it? If so, then yes, be my guest. It's perfectly safe. And if you're really concerned, if you have a disc herniation, if you have some severe arthritis, if you have some low back symptoms going on right now, ask 100%. It's okay to ask your doctor. It's okay to ask your rehab car. It's okay to ask those people about, hey, is this still right for me to do? 9 out of 10 times, they're probably going to tell you, yes, it probably is still okay to do. Or the 1 out of 10 dentist is going to recommend, you know what, let's go ask somebody that maybe does this better than me. Maybe I need to go ask Nick down the street. Maybe I need to go ask Austin down the street because he seems to be the guy that probably has a little bit better insight to this. Let's go ask him. Do you have any other closing remarks? Really, like, because
No,
that's how I answer it in our clinic. Is like you said, is it important for them? Does it move them closer to their goal? And is it helping them accomplish what they need to? If so, then I'm going to use it as a tool. But it's a tool in the toolbox, basically.
no, absolutely. It's just a tool. There's 18 million different ways to skin a cat. For a lot of people, you do not need this in order to get the results you're looking for, especially when working with pain. However, it is also a fantastic tool when appropriate. And so that's the thing that you got to differentiate. Is like, are we using this at the right time? Is this something that I actually care about doing? If it just leaves me sore, because you also still got to think about if I'm deadlifting moderately heavy because I'm trying to get a different exercise optimize and get it to stop hurt, but we're using deadlifts to build up tolerance to the low back. It's like there's a lot of systemic fatigue that comes
Oh
with
yeah.
these things. So it could be even taken away from some of the other stuff that we're looking, because we tire out so much in the body when we're doing this. Um, and so we got to dial these things in and just, and again, realize this is a tool in the toolbox. Much like for chiropractors, the adjustment is a tool in the toolbox and is not everything that we do. Not everything we do for low back pain patients or people like that is do deadlifts. So it's not the whole thing, but it can be a very important and helpful part.
Absolutely. I like it. We'll close on that. So to answer your question, if you're listening and you've got low back pain, you've got a disc herniation, you've got maybe some hesitation with utilizing a deadlift, obviously always consult your doctor first. Talk with your rehab specialist. Talk with your coaches, your personal trainers. In general, though, what does the actual evidence say? The evidence says when the tool is correct, you're good to go. Oh, look, we got a puppy appearance. Hell yeah. Special guest. Fantastic. Whenever the tool is right, if it's the right time, the right reason for the right person with the right goals, it's good to use. So this next week and some following weeks, actually, we're talking some more different exercises, squats, deadlifts, shoulder presses, and in fact, we actually have our first round of guests coming on. I won't tell you who it is because I'm actually pretty excited. He's one of my really good friends here. And then in the following weeks, we should have some guests coming on as well. From other professions, including potentially some massage therapists or physical therapists, a few other people in terms of potentially some athletic trainers and some other coaches. So we're going to be digging in here and getting some other healthcare professionals. In fact, actually, I might actually have a pain specialist as well as a surgeon, which sounds crazy, right? Like, we're not supposed to like each other, but newsflash, we like each other. It's okay. We enjoy each other.
Okay.
I promise. It's okay. I promise.
Blasphemy.
I know, right? Right. It's like, oh, I thought you hated each other. No, we get along just fine. We just know what we're really good at. And it turns out if you stay in your own lanes and you support each other, we can all get along. Imagine that.
Imagine that.
I know, right? It's crazy concept. So in the following weeks, look out for those. Otherwise, we will see you guys. And that kind of puts a pin in it. Is deadlifting a safe exercise for you? The answer is always Nick. It's your favorite line.
It depends.
It's my favorite. That's my favorite. I like it. We need to get sponsored by Depends. Not that I want to use them,
Honestly.
But,
Yeah, I'm not putting them on my camera, but
Is that a line? We'll see. We'll see. I like it. All right, we'll see you guys next week. Peace. If you've made it this far, chances are you care about moving better, training harder, or finally getting rid of an injury that's been holding you back. If that's you, we've put everything you need in the description below. Our podcast, social channels, free resources, and even a way to see if body kinetics or RTA is the right fit for you. And if you learned something today, send this episode to someone who's still being told to stop lifting, stop running, or just live with the pain. It might be exactly what they need to hear. Thanks for listening, and remember, keep moving, keep lifting, keep asking better questions, and we'll see you next week.